And Martha says, Susan looks 15 years younger. Now, I want you to do for me what you did for Susan, except I want you to make me look 20 years younger.
This is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice.
Ask the patient what you can do for them. So imagine that conversation, it was about the mountain bike. And at some point, clearly it's going to shift. And Paul or Tim are going to say something like this, Tim, it's so nice to meet you today. I appreciate that you've chosen my office for your dental care. What can I do for you?
All right.
And listen, because you could get all kinds of responses. Well, doctor, I just moved to town. I met my neighbor next door. We're trying to get settled in, and I wanted to find a dentist. I talked to my neighbor next door, and she said, you guys were awesome, and that's why I'm here. Nothing's going on. I just wanted to get established.
Right. Another question I think you taught me is, if you and I are talking in 3 years, what should happen to your oral health and smile for you to be happy with that?
Now you're getting way ahead. Don't start there.
Right.
Don't start there.
Don't start there. Okay, got it.
Don't start there.
Right.
What brings you in today? What can I do for you?
Right. Just to kind of get acclimated, just get comfortable with the whole thing.
I mean, here's the answer you want every time. Imagine a patient, 62 years old, female patient, 62 years old.
Mm-hmm.
And let's just call her Martha. And imagine Martha, when Dr. Paul says, Martha, it's so nice to meet you. I appreciate that you've chosen my office for your dental care. What brings you in today? And imagine Martha saying, well, Dr. Paul, I have a lady that I play bridge with, and her name's Susan, and she's a patient of yours. And you did this beautiful smile makeover for Susan. And honest to gosh, Susan looks 15 years younger. And of course, now Paul's going to remember her, of course, and Martha says, Susan looks 15 years younger. Now, I want you to do for me what you did for Susan, except I want you to make me look 20 years younger. Now, that's the answer you want every time. And let me tell you that you're not going to get that every time.
Right.
It might be, Doc, this tooth on the upper left has been keeping me awake at night. Now it kind of comes and goes. But sometimes it spikes and it's so much pain. I can't sleep. That's why I'm here. So ask, what brings you in today? What can I do for you? And then actually listen, because they'll tell you, and it gives you a starting point.
One that provides personal, professional, and financial satisfaction.